My name is Dr. Linda Rogers. I'm an associate professor of medicine here at the Icahn School of Medicine at Mount Sinai and the clinical director of the adult asthma program for the Mount Sinai National Jewish Health Respiratory Institute. And today is World Asthma Day, and we're here today to talk about asthma and COVID-19. So all of us who take care of patients with asthma have been concerned that asthma might increase their risk of coronavirus or increase their risk of having a more severe course if they contract coronavirus. We're concerned about this because even under normal circumstances, asthma causes some irregularities in immune response that may increase susceptibility to viral infections, and that patients under normal circumstances with asthma, when they contract viral infections, that can cause their asthma to flare. And there is, moreover, a subset of patients with asthma who seem to be very prone to wheezing and flares of their asthma when they get viral respiratory infections. We know that viruses are identified in hospitalized patients with asthma, but coronavirus is actually the sister viruses, the viruses that cause the common cold, the versions of coronavirus that are normally in the community are not a big cause of wheezing with viral infections. There are other viruses that cause wheezing more commonly. And we're seeing that asthma and allergies aren't really being found commonly in patients who are hospitalized with COVID and who die with COVID. There's been series out of China and of Italy that have found very low rates of asthma in patients with the severe courses of disease. And here in New York, out of 20,000 patients who have died of COVID, the most common chronic illnesses that we find are things like high blood pressure, high cholesterol, diabetes, heart disease, and other diseases. And asthma has actually not made it onto that top 10 list of illnesses in patients who die of COVID here in New York State, whereas asthma is a very common condition in New York. It's present in about 8 to 10% of the population, and that would suggest that asthma may in some way not lead to a higher risk of contracting COVID. If what we're observing in places like Wuhan or Italy or here in New York is true, and that there are fewer asthma patients in the hospital or dying of COVID than would be expected based on how common asthma is in the population, then the question is, why is that the case? Is it that an artifact of the way the question is asked or the data is collected in those surveys? That's a possibility. Is there something different about the way patients with asthma behave that reduce their risk of COVID? Well, that doesn't seem the case with these other chronic health conditions, so I don't think that is the likely explanation. Or is there something about the disease itself or the medications we use that is actually protective? And those are all possibilities, and some early research suggests that some of the medications, including inhaled corticosteroids, may actually lower the amount of the receptor in your airways that is used for the virus to enter. And so that's one reason or one potential explanation why patients with asthma may not be at elevated risk of COVID and in fact may be of lower risk. And there are other studies looking at the genetics of our immune systems that also suggest that there may be certain findings that may actually lower the risk of COVID in patients with asthma. Now that data is not conclusive and I wouldn't change behavior based on that, but it would explain some of the things that we're observing in the data that we're collecting in terms of how common asthma is in patients who are severely affected by COVID. So a lot of the symptoms of COVID pneumonia and asthma can overlap. So for example, patients can have a cough, patients can be very short of breath, but COVID is also very different in that oftentimes patients with COVID pneumonia report difficulty taking a deep breath, as opposed to patients with asthma who often find it difficult to exhale. And so the quality of shortness of breath may be different. Patients with both COVID and asthma might experience chest tightness, With patients with asthma, typically their chest tightness or discomfort would respond to their quick relief medicine, albuterol or similar medications, whereas it's less likely that the symptoms of COVID would respond to those medications. And moreover, with COVID, you're likely to have other symptoms other than symptoms such as cough, chest tightness, or shortness of breath. For example, oftentimes, at least some time in the course of their illness, patients with COVID will have fever, chills, fatigue, muscle aches. Some often have gastrointestinal symptoms like diarrhea, and alterations in taste and smell. And so eventually in your COVID course, you're more likely to have some other symptoms that would point in the direction of COVID as opposed to just your symptoms related to your asthma. Um, that's an interesting question. For those of you who are supposed to be taking daily medicine to control your asthma and you're less than 100% perfect about doing that, I would say that now is a really good time to be taking your medicine regularly and making sure that you keep your asthma under control and stay out of the healthcare system. There's not really any benefit to taking your quick relief medicine extra unless you're having symptoms that you need relief for. But I think it's very important to be very good at maintaining your maintenance medicines that prevent and control your asthma and keep you out of the healthcare system where you would be more likely to contract COVID. Many or most patients with persistent asthma take inhaled medications to control their asthma with ingredients such as inhaled corticosteroids. And there has been some concern that those medications may reduce immunity. But in fact, at least some early data is suggesting that the opposite is in the case. Looking at some experiments in the laboratory, the use of inhaled steroids may actually lower the presence of the receptor ACE2, which actually is used by the virus to enter into the lungs and cause infection. And so while that's very preliminary data, it would suggest that actually the medicines are not harmful and actually may be protective. Well, this is a time of anxiety for all of us. It's a time where things are stressful and there's a lot of change. And we all know that stress is a driver of asthma symptoms in patients with asthma. And so we all need to be doing things to manage our stress levels, uh, getting enough sleep, eating well, making sure we're taking asthma medication that controls our asthma. And even though we need to be socially distancing, trying to spend time, at least remotely, with our friends and family to try to reduce our stress levels. And so that really remains unclear at this time. I think that bronchodilators are often used to treat symptoms such as cough and shortness of breath. Sometimes even prior to COVID, those are medicines that might be used in a hospitalized patient who was having difficulty clearing secretions and difficulty breathing. Whether those are actually effective in COVID pneumonia remain unclear, although they are being used in some hospitalized patients. I think the most important thing right now, if you have asthma during the time of COVID-19, is doing all the things that you try to normally do to maintain your asthma control. Stay on your control medications, don't stop them. Monitor your symptoms. If you have a peak flow meter, you can monitor your peak flow. Stay in touch with your healthcare provider. That may be by telemedicine in this era, and definitely reach out to your healthcare provider if you're having any symptoms that might suggest COVID-19 or worsening of your asthma.